Hello, my name is Darius Carter, and today I'm going to be doing and describing a time where one of my family members had an interaction with a health clinic professional or multiple professionals over the time. This was for probably 10 years that this happened. So, my mom, growing up, for me, which I don't mind saying this because I'm a very open person and I don't mind who sees it. My mom was a drug addict growing up for me, so that was honestly hard to see, but also very different from other people's lives because I would always see how my friends' moms were acting and being, and how they were taking care of them and how they were there for them. So it was just different, but it was just a different kind of life. But growing up, I had definitely seen that she was in and out of the hospital for various issues with relating to health or disease, or like getting sick all the time because she would use specific kind of drugs that would make her sick. So an encounter that she had was that she would always be at the doctor. So she was or not the doctor, but the hospital. She was always trying to get help, but sometimes she didn't really need the help, so they would put her on specific medications that were designed for people who were addicted to opioids, to wean them off or to either not give them the supply that they need. Well, during the beginning stages, so when I was probably like 8, my mom would go there, and this was nearing the end of her life, but I'll get there. She would go to the hospital and she would try to get the drugs there because she didn't have any money. And so it had worked a couple times. It did, because my grandma used to get mad at her that she would go there, and it almost jinxed her. So she would go there, try and get help. And so these health professionals that were involved were like doctors and nurses, people who were charting her stuff and who had her on record, so that they had known her. They had known her as a previous user. And then the next question is, if only health professional was involved, do you think, or if only one health professional was involved, do you think it would have been beneficial? I think it would not have been beneficial, because more people were able to see what issues were going on, and so more people were on the case, more people were like, hey, this is what's happening, so they're able to come together. And when people are coming together on a topic or an issue, they're able to like sit down, think about it, talk about it, and discuss it through, like people do with health plans and nursing. So over the time, she would go and she would get these drugs, but eventually they stopped giving them to her. And one time she went there, and this was 9 days after my 10th birthday. But when she went there, I think it was the 18th. It was on a weekend, because I was supposed to go over there with my sister to stay the night. But that's beyond the point. She'd went to the hospital. Now the doctors there had already known her, and they thought, hey, she's coming back to use. We're not going to let you in this time. The hospital's pretty full right now. We can't see anyone for a while. So they sent my mom home. And when they sent my mom home, she called my grandma. My grandma is a nurse. My grandma raised me before for some time, and then after this as well. I would usually go over there on weekend visits. This was at the time, though, where my mom was clean. So she was clean for about a year or two at this point, and so it wasn't really making sense that they didn't let her come in or even get help. So I think that these physicians and these nurses that had sent her away were actually hurting her, because she ended up passing away 5 days later or so. And so that just shows that these health professionals went wrong when they could have helped. They could have done something. They could have at least taken her in and given her an MRI or something. If she's saying her head is hurting and she's kind of feeling very off, very foggy, stuff like that, those are all signs. And so in your checklist as a nurse, if you're hearing this stuff, you're supposed to assess right there. You're supposed to start assessing it immediately. When you see stuff, you hear stuff, you're automatically doing an accession, or like a rundown of those symptoms. So I think that this really hurt them. Now the last question being is, reflect on how these health professionals worked. Well, I kind of just did. They really could have done a little bit more in order to help my mom out, because if they did, then they could have caught that brain aneurysm that she did pass away from, and it maybe could have saved your life. Thank you.